the studio with Christine VandenDries. She is in the home support team and is going to enlighten us a little bit about what's going on in home health, home support, mostly home support. But I know some of us are still a bit confused about the difference between home health and home support. So Christine, I'm going to ask you to clarify that first.
Sure. The difference between home health and home support is certified home health care is provided in your home when you're homebound, so following a surgery, a fall, anything that makes you unable to safely leave your residence without assistance, with whether that assistance be a walker, a wheelchair, another person. You have to be considered homebound. And then once you are considered homebound, those services are paid for by Medicare.
Okay.
So there's little to no out-of-pocket cost, just depending on the type of insurance that someone has. It is also available to people that have private insurance, depending on what season of life they're in, but those private insurances may have different reimbursement rates. But generally, Medicare covers all certified home health services, and we do things like complex wound care, we do medication management and review, we do disease education. If you have a new complication of a chronic disease, you have diabetes and have been taking pills for years, but all of a sudden you go in the hospital and come out on insulin injections. We can do injection training. We do post-surgical follow-up for patients that maybe have had cardiac surgery, a joint replacement. And usually those services are limited to a 60-day window at one time. So each time we do it, it's for 60 days, and then we reevaluate.
Okay.
Some people need less time, maybe 4 or 5 weeks. Some people need more, and then we recertify them for another episode, again, under Medicare. Home support services have a much broader menu and a different way of paying. Home support services are either paid for out of pocket or through long-term care insurance, depending on the reimbursement rate of your policy and the rules that go along with it. Home support services can do a lot of the nursing care that home health does. They do wound care, they do medication management, they can educate you on new diseases, teach you fall precautions, all of those things. But they also have a aid component that comes with it, which is what most people take advantage of. So our nurses come out and start a case. They look at all the paperwork from the doctors, take into account what the family and the resident says, what their concerns are, create a plan of care for the resident. For things like medication management, a nurse can come, fill a pill planner, and then an aide can come and remind you to take those medications and watch you to make sure that they're taken if that's a concern. Our aides can also help with personal care, bathing, light cooking, laundry, changing bed linens, things like that. They also can do escorts to medical appointments, both on and off campus. They can offer assistance like after you had to stay in the hospital. If you're unsure about being home alone for the first couple of days, they can offer assistance during that time as well. And that's for our specific, like our CNA aid service.
Okay.
But home support also offers companion workers, and they do sort of a different kind of care. They can do escorts to family events off campus. They can do escorts to on-campus appointments, to the dining room.
Now, how is that transport arranged, though?
They call the home support office, and currently we've got 3 or 4 schedulers down there that take phone calls all day long and set those visits up. So the residents tell us what they need once they've established care with us, and then they set that up. So some people just get maybe an hour for an escort to and from dinner. Some people get 4-hour blocks to help get ready and kind of sort their day out. 24-hour care is also available. We have some residents here that take advantage of that service, and they have someone with them at all times. And that's really good for people who are maybe sort of thinking about assisted living might be coming, but they're not ready to give up their independent living apartment yet. So a lot of people take advantage of that 24-hour assistance without leaving their home. Home support is wonderful because you don't have to be homebound to get it. You can go out in the community, you can go to your meetings, dining, you can go to family events, and it doesn't it's not required that you be homebound.
Okay.
Last week when I was on, I was asked, can they help organize closets?
Oh.
Our home care workers can. They can help you unpack after you've moved. They can help get you settled after a long hospital stay or a long vacation. They can go in and freshen up your apartment for you if you've been gone for a couple of weeks. They assist with pet care. I see some of them out walking pets in the neighborhood just to kind of help out, especially if someone is laid up after an illness or a surgery. So they have a lot of benefits and things that they can do. They help, like I said, with all kinds of laundry, ironing. They can help with holiday gift wrapping and addressing Christmas cards. I mean, there's so many things that the home support staff can do to help, whether it's a short episodic thing or if it's an ongoing long-term situation while transitioning. The other difference between the two is that home health care happens in your home. If that's independent living or assisted living, that's fine. Medicare will pay for it because you can't get a skilled nurse from the assisted living staff. They don't have a skilled nurse to do treatments. But once you go into a skilled nursing facility like Garden Ridge, where they have their nursing facility, they provide skilled nurses. So home health cannot be in there.
Oh, okay.
But home support can be everywhere.
Okay.
So if you have a stay in Garden Ridge and you're concerned that you might need assistance in the middle of the night to get up, aides can go to Garden Ridge and help you there at night. If you're worried about getting up, getting dressed, getting to the bathroom at night, they can go all over campus. So that's a really nice benefit of home support.
Right, it is.
So.
Sort of like having a daughter around.
Yes, yes. And our aides are wonderful. One of our aides, Renetta, she was just named for one of the elite awards. She is well loved by our residents and gives them exceptional care. One of them even commented that her visits with him are like a spa day. So they take it seriously, and they really try hard to make every experience with the residents one that meets their needs, but also is on the level of care that they want.
Right.
So, and all of our aides function under the supervision of the RN that goes out and starts their case. So they're checking back in, they have a plan of care that they have to execute. So it's not just sort of I show up and do whatever I want to do sort of situation. Right. They've got a list of tasks that they need to perform and report back to the nurse on. This resident wouldn't take the medication, I'm concerned. They call back to the office. If their nurse isn't available, then I'm available, and their two clinical managers, Sana and Krista, are available for a resource to help them sort out any issues. So.
Okay.
Yeah.
Okay.
And then we're getting ready to, I know we keep talking about it, but we're getting ready to switch our uniforms for our home support team.
Okay.
They've been walking around in green scrub tops for as long as I think anybody can remember. They have ordered them a new uniform that they're going to start wearing hopefully in the next couple of weeks. We had some issues with sizing. And so they're going to be wearing, I brought them so everyone can see, they're going to begin wearing these blue polo shirts. Let me see if I can turn it the right way.
Okay. Wow.
With the green screen logo and home support written on them. So start looking for these in the coming weeks. That'll help distinguish our caregivers for home support.
Okay.
So,
okay.
Yeah.
Now, we have home health,
Mm-hmm.
we have home support,
Yes.
and under home support we also have companions.
We do.
Okay, how do they differ from the regular home support?
They're all under the same umbrella. So home support is kind of the umbrella that covers the home support nurses, the home support aides, and the home support companion workers.
Okay.
So our aides are CNAs, and they're trained in personal care
Which
tasks.
means CNA.
Certified nursing assistant,
Okay.
trained in personal care tasks, bathing and safety in that clinical way. Our companions do non-clinical, non-personal care sort of tasks like around the home, and can also work as escorts to help people get to and from different events. Our companion workers also have the ability to help get someone to an airport or accompany them if they're traveling to an airport.
Oh, really?
They do. They can also assist with getting to things like family reunions and different off-campus activities. If there's, a club meeting, if someone's part of a,
Well, now, do they drive?
Generally, I actually don't know the answer to that question. I know generally a lot of them just accompany them. If it's off-site transportation off-site that they've arranged, then the aide goes with them just to ensure their safety and make sure that they have everything that they need while they're there. I imagine getting to the airport via taxi or a private driver and then having to negotiate all your luggage into the airport through security can be difficult as we age. So I know that our aides are able to help with that. Our companion workers are able to help with that. So they also do different shorter services where they can come in the morning just to help get up, just to help get ready for bed in the evening. Our medication reminder visits are generally pretty short, just a quick check-in, make sure that the meds are being taken and that there's nothing that's needed. And there's different like touch points during the day that they can also do. If someone is concerned that maybe they go to intermissions, but the time after intermissions before dinner, they need someone just to check in on them, they can arrange some time in there as well. So home support has a lot of flexibility in how they can serve our residents.
So if someone really thinks, oh, I really need some help on this, I don't want to call my neighbor, I wonder if home support can help.
Give us a call. Give us a call. Our schedulers and our clinical managers can kind of help sort out what exactly the service is that's needed, and then kind of customize how many hours are needed, and then talk about payment options. And then we have someone in the office who handles all of our long-term care cases. He's really versed in how long-term care works and can help sort all that information out too.
Sounds wonderful. Thank you so much, Chris.
You're very welcome.